So I'm Karen Cruz-Thomas. I'm the Bloomberg School historian, and this is our 9th Lunch and Learn lecture for the Centennial. I can't believe it. And next month in June, we will have a film fest. And it won't be a regular talk, but it will be different film and video clips of Hopkins faculty from across the ages. This talk is going to draw together a lot of themes from previous talks. We're going to talk about science, urban health, all sorts of things that we've been talking about for the past 8 lectures are going to kind of come together in this. I'm really excited about it. And plus, it's just a really fun subject. It's so fun, in fact, that I actually have an antique beer can from Carling Brewery, which used to be here in Baltimore. And I'll explain why we have that there in just a moment. So, sex, drugs, and public health. The main theme of this talk is the emergence of the social and behavioral sciences as a really central discipline in public health, which it was not when William Henry Welch founded the school in 1916. At that point, of the 9 founding departments, I think 5 were basic science departments. And even though social sciences had been very important for some people in the progressive movement, and even the term social hygiene was coined at that time to refer to venereal disease control, social sciences are kind of a long time coming into public health, especially academic public health. But there's certainly an undercurrent for a long time. So what I want to talk about is how did social and behavioral sciences come into public health practice, and why was Hopkins slower than many other schools to embrace this discipline? And then once we did embrace it, it was really in the 1960s and 70s. So what was going on during that period that really brings the social and behavioral sciences to the fore? And then finally, since 1980, how have social and behavioral science methods in public health evolved? And how does it really become a game changer in how we fight both infectious and non-communicable disease? So I'm going to talk a bit about the early research at the school on social and economic determinants of health. So the Department of Mental Hygiene was originally the division was founded in 1941 with Paul Lemkow as the head of the division, and he remained after the division became a department in 1961, and he was chair until 1974. And Lemkow is absolutely a giant in public mental health. And with his colleagues in his department, he published in 1941 an article on schizophrenia, manic depressive psychosis, and socioeconomic status. So that's a very early example of the social determinants of health. And he looked at occupations and socioeconomic status using the Eastern Health District records, which I've talked about extensively before, to match those demographic and social data with the rates of mental illness. And he came to the conclusion that schizophrenia was more of a lower class thing, and manic depression, now known as bipolar disorder, is more an upper class thing. I don't believe he was right, but that is what he concluded back in 1941. So Lemkow was a psychiatrist, and there were a number of, but the first, I would say, kind of card-carrying social scientist to join the faculty was Daniel Wilner. And he was a PhD in sociology, and he was in the Department of Public Health Administration, which is now Health Policy and Management. And he did a really fascinating project. It was interdisciplinary and interdepartmental, and it pulled in several different Baltimore City agencies. And he was looking at the effects of housing on not just health, but on family life, on education, on school attendance, for instance. And he employs some very sophisticated social science and statistical methods. And one of his main determinations, so he looks at two groups of children with cases and controls, and he tries to analyze what the difference is between children who live in what was then called slum housing, unrenovated. You know, the Baltimore had a very poor housing stock, and that was a major cause of many types of health problems, versus what was then considered the good housing, public housing, newly built government-funded housing. And he found that the kids who lived in, the school-age kids who lived in public housing, at that point at least, had far better school attendance rates because they were getting sick less. Okay? So Wilner is doing a lot of interesting and important things here. Hopkins really pioneered in the epidemiology of single-agent infectious disease. Go get the germ. Shoot it with penicillin. Magic bullet. But Wilner is taking a much broader social approach, and he's really looking at environment and society as the cause of disease. And so his research represents a very important turning point toward understanding the interactions among multiple different factors. And social and behavioral sciences are really ideal for doing that. So after Wilner, he leaves in, I think, 1963, anyway, shortly after this is published, and goes out to California. But the school's departments that really are at the forefront of appointing sociologists are chronic disease and international health. So the departments that are still mainly focused on infectious disease and the basic sciences, they are not interested so much in social and behavioral sciences. But chronic disease poses new problems that can't be solved with the old methods of infectious disease epidemiology. So chronic disease and international health are really the key conduits of social and behavioral sciences, and I'll explain more about that later. So when we think about pop culture and maybe history documentaries we've seen about the 1960s, so I've got 4 images up here. I don't know if you've ever read this, but there's a very famous, it's supposedly an autobiography. I'm not sure if it really was, but it's called Go Ask Alice. And it's a reference to both Alice in Wonderland and, of course, the Grace Slick Jefferson Airplane song. So we have increasing awareness of drug use. There had been drug use for a long time, but there's just an increasing awareness of it. The Life magazine cover is of an injured person from the Newark riots, so it's a very violent time. There's a lot of social upheaval. The picture in the lower left, I actually have that hanging in my living room. I absolutely love that photo. It's of an Army nurse in Vietnam caring for a malnourished Vietnamese child. And then if you know anything at all about women's history, you've heard of Our Bodies, Ourselves, published in, I think, 1972. So all of these things are really churning in the society. And it's really during the post-war period that sociology, economics, psychology, and psychiatry all come into the popular culture and also really increase in influence within the academic world as well. And politically, Lyndon Johnson's Great Society is pouring a lot of money into federal funding for health and social welfare programs. And because he's saying things like we need to fight the war on poverty as well as the war in Vietnam, which actually didn't work out so well for Johnson. But those, again, require social approaches. These are defined as social problems that we have to deal with on a community and a population-wide basis. So they're really tailor-made for public health because of our emphasis on population and community health. So one of the chief tools that sociologists use to study human behavior and populations is the interview. And Paul Lemkow and Abe Lilienfeld, Paul Lemkow, as I've said, was chair of mental hygiene. Abe Lilienfeld was first chair of chronic disease, then he was chair of epidemiology, and he actually served as interim chair of mental hygiene for a while. But Lilienfeld was so infused with social science methods as an epidemiologist. He was influenced by the sociologist Harold Dorn and a number of other early social epidemiologists. So in the 1950s, we have the Commission on Chronic Illness headquartered. The National Commission is headquartered at the school. We're doing very innovative survey research on chronic disease in Baltimore. And the founding of the Department of Chronic Disease, we had found a number of ways to prevent infectious disease, but we still didn't have hardly any effective methods of preventing heart disease, cancer, stroke. So Lilienfeld and people like him in epidemiology who were just really founding the field of chronic disease epidemiology grab onto social science as a wonderful tool for addressing the unique problems of chronic diseases. And joined, right beside him was George Comstock, who, in addition to being, an amazing tuberculosis epidemiologist and pioneering community epidemiologist on heart disease, cancer, and stroke. Lilienfeld and Comstock were kind of like the dream team of chronic disease epidemiology. But Comstock, when he opens this training center for public health research in Hagerstown, Maryland, is very ahead of the curve. He uses modern marketing methods, and he, in order to communicate that he's doing a survey in that county, in Washington County, he says he actually hires a advertising and PR firm to help him publicize the survey. So this survey methods and interviewing is at the heart of a lot of what's going on at the school in the 60s. And the interview comes from a lot of sources, but the godfather of the interview is Alfred Kinsey, okay? And we have a very interesting connection with Alfred Kinsey. So all the way back in 1949, when Lemkow is speaking at a conference, he talks about Alfred Kinsey, and he says, well, Kinsey was a careful student of the gall wasp, measuring them with a micrometer with minutest care. And then he turns to research on sex. And then he chooses a tool that was the only one that would give him the answers, the data he needed, the interview. Okay? So there's this major debate going on. People like William Henry Welch, Thomas Turner, and a number of others that I talk about in the book have a very classical understanding of what public health research should be, and it should be about laboratories and tracking germs and things like that. And it really doesn't incorporate much of a social perspective. But Lemkow, and soon followed by a number of other like-minded people, says the interview can be just as scientific as the lab, and it can do unique things that the lab can't do. So he's really fighting a prejudice against social science methods, and he says he is fighting for the legitimacy of social and behavioral science at a time when the, quote, hard sciences are really preeminent in the NIH, in this school, and across the country. So Lilienfeld, after he's been in the Department of Chronic Diseases a few years, Lilienfeld, for his very earliest faculty members, he hires a group of sociologists. He hires Margaret Bright, who is a United Nations demographer trained in sociology at the University of Wisconsin. He hires Mary Monk, who later goes on to do very innovative research on suicide, the epidemiology of suicide. So his first picks are sociologists. So he hires some of the very first sociologists on the faculty after Daniel Wilner. And he reaches out across to the Homewood campus, the liberal arts campus, to James Coleman, who is the chair of what's then called the Department of Social Relations. And Coleman is a very prominent sociologist. He does a lot of educational psychology, sociology. And together they found this really innovative interdisciplinary PhD program. We actually have an alum in the audience today who he got a master's degree in 1971, and he was in the very first Masters of Health Science class, actually, in 1971, and he got his degree in chronic disease, social epidemiology. Is that correct? Yeah. So they're bringing together these really, really powerful methods and doing something really quite new. Now, Saul Levine, who became very well known at Harvard Medical School for really helping develop the field of medical sociology, comes to the school in 1967 to start to be the founding chair of the Department of Behavioral Sciences. But there's a difference between medical sociology and public health sociology. And so as I go on, I'm going to try to pull out some of those things. So just real quickly, we've got the folks in international health. I'm not going to go into a lot of detail on international health, but they are also hiring sociologists because it's very important to understand when they're doing these national health surveys. They're going to Turkey and Chad and Peru, places that have never been surveyed before to find out what their main health problems are. Sociology and understanding of the overall population characteristics and the characteristics of the country is absolutely essential for the work that they're doing. So every international health research study done at this school had a sociologist consultant on it. And then Henry Moseley, who spoke yesterday for the PFRH Harper lecture, he founds the Hopkins Population Center in 1971, and that further dramatically expands survey research because there's a whole unit in the center devoted to survey research, and they're hiring all sorts of people from East Baltimore to come in and do survey work. And so the different departments in the school are basically contracting with that unit to do expanded survey research. So what is the interview? Why is Alfred Kinsey such a big deal? So Kinsey and three co-authors, Clyde E. Martin, Paul Gebhard, and Wardell Pomeroy, are at the Kinsey Institute, and they publish landmark studies, first in male and then female sexual behavior in 1948 and I think 1950 or 51 for the female study. This is mind-blowing. This makes headlines. When you actually read it, it's quite dry. And in fact, ironically, our chair of biostatistics, William Cochran, during the 1950s, so if you can get your mind around this, he is chair of an American Statistical Association study of the Kinsey studies based on their statistical rigor. Okay? So and they conclude, this is top of the line, rigorous scientific research, which is highly statistically relevant. So they really counted all of the, they did their math. So if you can imagine a statistician doing an analysis of the Kinsey studies, that's what our chair of biostatistics did. So I mentioned Margaret Bright. Margaret Bright, who I interviewed and is a very fascinating person, as I said, she came from the United Nations. She had assisted with the first UN population survey to find out how many people do we have in the world. Can you imagine the work and difficulty of such a thing in the 1950s, early 50s, with no computers? It was astonishing. So she comes out of the UN bringing that perspective, that international and demography perspective, into the Department of Chronic Disease. And in about 1964 or so, Ernest Stebbins, who's dean of the school at the time, sends Margaret Bright, who is an absolute world expert on survey research from her UN days, he sends her to the Kinsey Institute in Indiana to do, guess what? To help train CDC officers in how to take really, really good sexual case histories so that they can do a better job of controlling venereal disease, which is actually even though people thought, oh, syphilis, we're going to eradicate it completely. We've got antibiotics. Case closed. No. Federal funding declined during the 1950s, and the case rate started to go back up. And so there was, a lot of hand-wringing about the high syphilis rates. So they kind of realized, well, wait, we've got the antibiotics. Why isn't syphilis going away? It's because they weren't applying any of the social and behavioral techniques that are essential to lower case rates and, keep it down on a long-term basis. So Margaret Bright waxes very enthusiastically about the Kinsey Institute and says, the Kinsey mode of interviewing is the best I've ever seen. They interviewed all of us, and they start out by telling you, don't answer the question if you can't answer it truthfully. So imagine going to the Kinsey Institute for a week, hanging out with what were probably a bunch of somewhat uptight CDC officers, VD control officers, who were all male at that time. And then in the evenings, for fun, you get to watch the film archives at the Kinsey Institute. And William Masters and Johnson were there too. So it must have been quite a party. So Margaret Bright is doing incredibly versatile things. She is helping with STD epidemiology. She is helping with, classic demography. And she is also applying her knowledge to help fight chronic disease. To, first of all, find out what are the case rates in the population to begin with, which was done by using these survey techniques. And then how can we target the most high-risk groups, and how can we develop methods that will be effective interventions? And all of that uses social and behavioral science. So in 1967, the school founds the Department of Behavioral Sciences. And because it's a Hopkins department, it has science in it, okay? Now, keep in mind, at the medical school, there was a Department of Psychiatry, and actually around the same time, they tack on and behavioral sciences to their department too. So this is a larger trend that's going on. The behavioral sciences became so influential. I mean, it was really the turning point for behavioral sciences to become a really major discipline, not only in public health, but across the board. And to just give you a sense of that, in 1968, we opened a new wing. I want to say it's what's now the Stebbins wing. But that entire wing was called the Behavioral Sciences Wing. In our 10-year planning document, where we're looking ahead and figuring out what are we going to do for the next 10 years, they say, oh, we need to add 100 faculty positions, and 22% of them need to be in behavioral sciences, okay? So this gives you a sense. So by 1970, there were sociologists on the faculty in nearly every department in the school. They're playing a very important role in all sorts of different kinds of research. In behavioral sciences specifically, which was headed by Saul Levine. You see his name on the, so Social Stress is actually a more recent book from 2013, and Saul Levine actually left the, Hopkins in 1972 and went over to Harvard School of Public Health. But in the 5 years or so that he was here, he created a department that really does pioneering work on the influence of stress on health, stress on cardiovascular disease, for instance. There's also this new and, at the time, rather revolutionary understanding about the connection between mental and physical health. And finally, Norm Scotch and then the chair who succeeded Saul Levine, Paul White, do really interesting research on the way social organization affects health organizations and makes them either more functional or sometimes less functional. So looking at health institutions as a social organization. Really cool stuff. So we're going to move now, as I promised, sex, drugs, and public health. We're now going to move into sex. So that, of course, is Jane Fonda in Barbarella, 1968. And in the 1960s, there was a very interesting debate going on. And when we hear the term sexual revolution, I think we often think about, free love and Woodstock and, the summer of '67 and, and conservatives blamed all that bad promiscuity, a la Jane Fonda, on the availability of the pill, which was introduced in 1960, or approved by the FDA, rather, in 1960. But it's important to remember that the pill was only the latest development in a very long-term trend. Birth rates in the United States had been going down dramatically since 1900. Even without the pill, people were figuring it out. And so the supposedly conservative view of, leave it to Beaver, and the family with 2 kids, a male breadwinner, and a stay-at-home wife, that was, first of all, a middle-class vision, and it was one that was in part made possible by limiting fertility, okay? So there's a major, conflict going on here. Is contraception evil and going to destroy the moral fabric of the society? Or is it good and even humane and absolutely necessary for promoting both economic development and human health, especially improving maternal and child health? And when you get into societies that don't have the kind of healthcare and economic resources that the United States does, that factor in improving maternal and child health becomes even more important. So in 1956, Carl Taylor, who's then at Harvard but comes to Hopkins in 1962 as the founding chair of international health, Taylor, and it's interesting to note that in public health, and especially at this school, the most prominent leaders in family planning, both domestically and internationally, many of them were from missionary backgrounds. And Carl Taylor was certainly one of those. He was a missionary himself, and he was the son of Presbyterian missionaries in India, and had actually grown up in India. And he wrote in 1956 this brilliant and very insightful article in the Atlantic Monthly about, will India accept birth control? And he came at it from really, I think, the point of view that now characterizes a lot of what the school does in family planning. He says that women who are giving birth, one child a year for most of their reproductive life are at high risk of dying in childbirth. Their children are malnourished and unhealthy, and many of them die. I mean, I can't remember what the exact death rate was, but I think it was, with all those children, many families still only had 2 or 3 kids survive to adulthood. So the idea in India at that time was that you had to have a lot of children because so many of them were going to die, okay? And he says we have to flip that around. We have to convince people first that their children are not going to die. And then we can get them to accept and use contraception. And it will dramatically improve, the economy and quality of life and all of that. So he's coming at it from a very moral and very humane perspective. In 1959, Paul Harper, who I mentioned before, and Harper worked very closely with Paul Lemkow in mental hygiene. So Harper was head of maternal and child health, and Lemkow was head of mental hygiene. And in their work on preventing developmental disabilities, they were certainly applying these sociological perspectives and looking at the impact of complications of pregnancy and birth disorders, looking at the population-wide impact of those disorders. And so certainly they became really convinced that family planning was just absolutely essential for dealing with the problems that they were seeing right here in East Baltimore. So Harper, after being head of maternal and child health for 12 years, goes overseas to Pakistan with Marshall Balfour of the Population Council. And both Harper and Balfour are alums of the school, by the way. And it's Ernest Stebbins, who's dean then, and John Hume, who's assistant dean and soon becomes dean. Stebbins and Hume are in the national leadership who are, so in the book I talk about how extremely important academics were, especially academics in public health, in shaping federal policy on family planning overseas and in the United States. So Stebbins and Hume are in the American Public Health Association, in the Population Association. I mean, many of our biostatistics chairs had been president of the Population Association. So they're really shaping the attitudes. And in 1965, President Johnson makes a really major decision to commit significant federal resources to promoting family planning overseas, and they really focus very heavily on South Asia, in part because of Hopkins' influence, actually. And so the school is just like at the very heart of all of this interesting stuff going on in family planning generally and in foreign aid and USAID as well. And yet, remember Philip Startwell at the beginning? Remember what he says about birth control pills? So he is the chair of epidemiology. He is saying, wait, we've got to step back. This might actually be dangerous. He chairs the FDA committee that reviews birth control pills, and he also serves on the one that reviews IUDs. So before those things are approved in the United States, and as Sartwell is going on national television saying, hold on a minute, there are risks associated with this, Harper and Taylor and others on the foreign side are promoting those methods heavily with federal funding in South Asia. But they're doing so in a way that really integrates maternal and child health, primary health care, and family planning as part of a whole. They have a very holistic approach. And that, I think, is one of the most important ways that Johns Hopkins and this school has influenced international family planning and continues to do so today, is that humane understanding of the many, many different facets of contraception. It's not just contraception for contraception's sake, but it's for a broad range of reasons. So interestingly, after that 1970 announcement, Phyllis Pietro, who is a PhD student in political science, but also studies here at the school, she played a very important role in shaping the legislation in 1965 that brings in federal support and funding for international family planning. And then she comes to the school in, I think, 1978 on the faculty in population dynamics. And she leads a study showing actually oral contraceptives have, and she said in the press releases, she said she was really surprised by what a dramatic effect that oral contraceptives had on health benefits for women who took them. So it's important to note here, we're not comparing apples to apples. When Philip Sartwell was doing his research, the earliest birth control pills back in 1960 had, I think, 10 milligrams of estrogen in them. And so there's a dramatic decline because they realized, well, we don't need that much for it to be effective. So I do want to kind of qualify all this. So it is interesting how our schools' views and advocacy on something like birth control pills can change over time. And I found it very interesting that in 2013, Amy Sui, the director of the Gates Institute, after the American College of Gynecology and Obstetrics comes out and says, birth control pills are safe enough, we should really just be selling them over the counter. And she very strongly supports that and says in 2013, they're really one of the safest drugs women can use for birth control So Ernest Stebbins, who was, as I said, a national and international leader in family planning, I found his remarks on the sexual revolution very interesting. So in 1963, he was enough of a national figure that he was asked to do a book blurb for Alan Guttmacher's Planning Your Family, The Complete Guide to Contraception and Fertility. And of course, Guttmacher was the president of the National Planned Parenthood Association, and he also has a very important connection to Laurie Schwab Zabin, and they together found the Alan Guttmacher Institute in the early 70s, which is the research arm of Planned Parenthood. And so that's really at the heart of what Population Dynamics, now PFRH, and the Gates Institute go on to do, and their strong research focus. So Stebbins says, I really like this. It's the most complete and authentic information, and it's great. But he says, I'd prefer that the phrase sexual revolution not be in the title. Apparently, for marketing purposes, they're thinking about changing the title. And he says, and back to what I said earlier, he said, this is not a revolution. People have been having sex. People have been preventing births. And in the United States, the decline in fertility is directly related to the increase in women's level of education. And so, he agrees with that. He says, it's really not a sexual revolution, and that's like a Time magazine-y kind of thing, and you don't need to put that in there. And they don't, so. So these are some just interesting images to illustrate some of this. Stebbins testifies, so this 1966 hearing on the population crisis, there's two cartoons that appear in a full-page ad in the New York Times to try to generate more popular and political support for what the Johnson administration is doing. And you can see that basically it's, the stork, the symbol of delivering babies, is very, very burdened by this world population growth. And Paul Harper, when he's writing the grant for the Ford Foundation to found Population Dynamics, says, other than the nuclear bomb, this is the biggest, scariest thing we're facing in the world right now. And in Baltimore City, John Hume was really a national and international leader in STD epidemiology, And so with the influence of those changes in methodology that I was talking about earlier with, Kinsey-style interviewing, even the Baltimore City Health Department, who's working closely with the STD control folks, Hume and others at the school, they're going out on the block where all the strip clubs are in Baltimore and really, doing a much, much more effective job of getting out in the community and really addressing the problems where they're worst. And then finally, another reference to Phyllis Piotro, who's a really amazing figure. In 1987, the year, yes, I graduated from high school, this is what some of you have probably never heard of and don't even know what it is, a 45 record, like those vinyl round thingies. So this was a really landmark pop song. It was the first time that public health communication had really been used the forum of popular music. And it was incredibly, incredibly effective. And D.A. Henderson, who was dean at the time, when Phyllis came to him and said, yeah, I want to do this new communications project and see how this works with improving contraceptive use, he said, well, you've got to document, you've got to evaluate it. It's got to be good, rigorous research, okay? So how are you going to do that? So, you play songs on the radio, and, how do you measure that? Well, her way of measuring it was they had a hotline number that you could call. And every time those songs went on the air, and they had some of them with Lea Salonga, who later becomes very famous on Broadway and as the voice of Mulan and the Disney movie and everything. Lea Salonga, when she's still a teenager, does one of these. They do it with King Sunny Ade in Nigeria. I mean, it's an international pop song campaign. It's just brilliant. But the way she tracks the effectiveness is to have these hotline numbers with these old things they called telephones that you picked up and talked into. So when the hotline number came out on the radio and these songs were played, they would just light up. So they had so they had both the phone calls to the hotlines and they were tracking visits to Planned Parenthood and other contraceptive clinics in the areas where this was being done. So really, really fascinating stuff. I'm going to skip over this. Let's talk about booze for a moment. I have this Carling Black Label beer that I bought and keep on display at my house because I just think it's so cool. It doesn't have one of those safety tabs. It was the pull tab kind where you would drop it on the ground and cut your foot on it and stuff. So the alcoholic beverage industry was really interesting. So like the tobacco industry, the alcohol industry viewed its product as very, very safe and wholesome, and everybody should use it. And both tobacco and alcohol companies saw that, yeah, maybe a few people might get sick, but they're a really small minority. And with alcohol, it's basically it's something about your personality that is wrong with you. And so if you have that problem, here, we're going to put a little money toward trying to help you out because we're a good corporate citizen, okay? So, and that little picture that I showed a minute ago with the happy family, we could also have dad and maybe mom too having a nice Carling brew in their hand, and that would have made a good advertisement, and that would be very typical for the time. So the Carling Brewing Company, which produced 800,000 and had a capacity of 1 million barrels of beer annually, and it was located in Halethorpe, outside Baltimore. So a faculty member in mental hygiene, Abraham Schneidmuhl, really pioneered in the concept of applying a public health perspective to the problem of substance abuse. And he had alcoholism clinics going on beginning in 1961. This was a time when, Alcoholics Anonymous was out there, But there were certainly no public health departments really dealing with alcoholism. And if you had a serious drinking problem, other than AA, like there were no rehabs, most people simply did not view, health professionals and the public alike did not view alcoholism as a health problem or an addiction. And so Schneidmuhl really pioneers he starts this little alcoholism clinic, and he does it in partnership with the Baltimore City Health Department and the Eastern Health District. But soon it's picked up and sponsored in the brewery building, really, by Carling. And so it catches on. There's obviously a huge need for it. And again, like Comstock in Hagerstown, Schneidmuhl and the Baltimore City Health Department, they're doing a PR and advertising blitz. They're using modern communication methods. They're advertising these clinics on the radio, on all the different stations that they think will get out to the people that need to hear it. And it just grows like gangbusters. People obviously want this alcoholism treatment. So Schneidmuhl is succeeded by Wallace Mandel as the director of the clinic, and he comes onto the faculty in 1969. And Mandel takes it to really a whole new level. He founds the first alcoholism counseling program at the graduate level in the United States, here at this school. And he gets there is this wave of federal NIH money coming in for substance abuse and addiction research. So the founding of the National Institute for Alcohol Abuse and Alcoholism, okay. And there's a lot of terminology, fights over the definition of those terms. But, and then also NIDA, National Institute for Drug Addiction, is also founded around this time. So the Department of Mental Hygiene in the 1970s is really almost fully funded by substance abuse research. And Mandel he becomes one of Richard Nixon's advisors on drug policy, and he's sent to do a national evaluation of the brand new kind of flagship Nixon administration drug addiction reduction program. And he gets Nixon really mad at him by saying, it doesn't work any better than the non-federal programs. So, of course, Nixon kicks Mandel out of the administration and he comes back to Hopkins. So those are some of the ways, the problem of heroin addiction, of Vietnam veterans coming back from Vietnam addicted to heroin and other substances. That's one of the things that really makes national news. And then seeing drug addiction as in very racial, gendered, and class categories, that it's poor African-American men who are mainly the heroin addicts, which is not accurate, but it's the public perception at the time. So the Department of Mental Hygiene is really playing a very leading role in developing new interventions and new ways of surveying and doing the epidemiology of both mental illness and substance abuse. So when we get into the 1980s and 90s, David Celentano, who's here with us today, is trained by both George Comstock and Abe Lilienfeld. So is that correct, David? I'm sorry. And David McQueen. And he's a sociologist in behavioral sciences, right? Yeah. So David Celentano, his career really exemplifies the rise of social and behavioral sciences in public health. And of course, in the 80s, the AIDS epidemic completely changes all the rules. So the idea that STDs were on their way out, they had already found by the early 60s that, we're not really solving the problem with antibiotics alone. We need to do more survey research and case finding. But then in the 1980s, these methods that have been kind of percolating for a couple of decades are there at just the right time when the HIV/AIDS epidemic hits. So, for instance, Dr. Celentano had done his training here at Hopkins on alcoholism, and then he moved into sexually transmitted disease research using his survey interviewing know-how. And then in the early 80s, Frank Polk comes to him. Frank Polk was the director of infectious diseases in the Department of Epidemiology and also had an appointment at Johns Hopkins Hospital. And Frank Polk, who's this very tall, rather gregarious Texan, says to David, I need someone who knows how to talk about gay sex, okay, with gay men. And so David Celentano creates the survey instrument that's used in the what becomes the MAX study, the multi-site AIDS cohort study. Thank you. Thank you. So that's founded in 1984, and it goes on to become, there's so many acronyms in my head you would not believe. Sorry. It becomes one of the most influential and the longest running HIV/AIDS cohort study in the United States. And David goes on to do very influential work, especially in Thailand, with military conscripts and HIV epidemiology overseas as well. And then there's also a connection between the social and behavioral science methodology used in STD and AIDS research and that in drug addiction. So those two threads kind of come together in looking at how can we prevent HIV/AIDS transmission in injecting drug users. There's just Ed Hook and Jonathan Zinnemann were very influential in developing research that they were the heads of the Baltimore City venereal disease program, as well as on the faculty here at the school. And they did some really pioneering research, but we're running out of time, so I'm going to try to move forward here. And then I think, kind of one of the climaxes of the whole trends in both STD and substance abuse epidemiology is the development in 1991 under Baltimore Mayor Kurt Schmoke of the needle sharing program that was based in part, they convinced the Baltimore City Council to pass the program based on the research done with the ALIVE study. And that really becomes one of the largest needle sharing programs in the country and provides a lot of the evidence base for that methodology to be spread across the country. So I'm going to wrap this up by, just a gauge of, this is how many centers at the school have been founded that have a really strong social behavioral sciences component. And you can look at all the different department names. So we're really like looking at, at least half of the departments in the school, and the date they're founded. So the 2000s, things just really pick up with the founding of different centers dealing with everything from public health and human rights, alcohol marketing, prevention of child sexual abuse, autism and developmental disabilities. And then finally, so in the 1970s, after Saul Levine left the school and went to Harvard, The problem that behavioral sciences had was there was this enormous optimism. Remember, we're going to hire 22 more faculty. This is when the faculty is really small in the school. Well, behavioral sciences was a department somewhat like biostatistics that was providing a lot of consulting services to other departments, and it was fantastic at doing that. But there was no funding stream. And so behavioral sciences, especially after the founding department chair leaves, kind of falls on hard times. And that's a whole nother story. But in 2004, I think one of the most striking comments on the influence of social and behavioral sciences at the school is that in 2004, Bill Eaton becomes the first non-MD to chair mental hygiene. He's not a psychiatrist. He's a sociologist. That's huge. In 2005, Health, Behavior, and Society is founded as a standalone department, and it really recognizes the importance and really the essential need for such a department within the structure of the school. And David Holtgrave, who's also here with us, is named chair in 2006. And then in 2009, David Celentano becomes, again, the first non-MD to chair the very, very famous Department of Epidemiology. So at that point, there's actually 3 social scientists who are chairs among the 10 departments in the school. So that gives you an understanding of just how influential those methods had become. And then finally, I'll close by saying in 2014, the Department of Health, Behavior, and Society founded the Lerner Center for Public Health Promotion, which is one of the, there's just so much possibility and promise on the horizon for using modern communications and marketing methods to encourage public health professionals and policymakers to actually implement and adopt public health research that often sits on the shelf for a long time. And Health, Behavior, and Society over the past 10 or so years has become not only the 4th largest department in the school, but also one of the strongest of its kind in the United States. Thank you very much. So, do we have questions? Arguments? Disagreements? Anything? Yes,
Sure,
Dr. Wang.
My recollections there are 1 and 4 behavior scientists during my era of studies. Hopkins and George Vassek
Yes.
and Richard Smith
Right.
and Monroe Leonard.
So Thomas Wang just mentioned George Vlasic, Richard Smith, I'm sorry. So several faculty in the Department of Behavioral Sciences, many of those had come from Harvard and had a medical sociology background.
And most important is Tom Bias.
Yes.
Much more influencing research capacity.
Right.
Conduct international study on medical care.
So I would actually like to ask you a question. Can you talk about, so these folks were, many of them were coming from a medical sociology background, but in a school of public health, this Department of Behavioral Sciences had a different focus and approach that was really very pioneering at the time. Can you talk about how that department kind of departed from medical sociology?
Well, as you probably recall, the definition of medical sociology is 2 different streams. One is medicine sociology in medicine, sociology of medicine. So behavior science is more geared toward sociology in medicine. That focus a great deal of stress impact on cardiovascular mortality and epidemiology of chronic illnesses. So that's a different stream. And I can recall Sullivan, Albright, and developed a theory called domain consensus. That had a tremendous impact on organization development. as one of the mainstreams in organization.
Yeah.
They were the frontier.
Right.
And also, at that time, Norman Scotch is interested in anthropology. I think Dave has much more knowledge of that. And, really
You said encephalology, study of syphilis? Yeah,
more
right.
anthropological contribution to study disease.
Right.
And at that time, the journal Chronic Disease was the most dominant journal that documented what are the social factors, cultural factors, maybe associated
Right.
manifestation of disease.
And that's a great point to make. So the Journal of Chronic Diseases, which was housed here at Hopkins, had been founded as the Journal of Venereal Diseases by Joseph Earl Moore. And he's the one in 1956 or so who changes both the name of the journal and the name of the venereal disease clinic at Johns Hopkins Hospital. He changes it to chronic diseases. So that kind of paves the way for Abe Lilienfeld to come in and take over as chair of the division that Moore had founded. And so that, that shows a clear progression from infectious STD methods into chronic disease methods. So, yes.
Hi, I thought this was really interesting. I'm a doctoral student in HBS, but formerly a
Thank you.
student in social and behavioral interventions in IH. So I think I've experienced sort of this, trail of behavioral science throughout the school, and also worked with CCP, which is kind of coming from Potsdam over to HBS. And so I was
Yes.
kind of thinking through sort of how behavioral science has sort of shifted around in different parts of the school. If that's sort of part of the history of it being a consulting department to a lot of others in the past, or is it something where you're seeing more consolidation over time of behavioral science within the department, or do you continue to kind of see spread throughout?
Well, I think, so you asked a very interesting question, which is how was behavioral science spread throughout the school, or is there a trend toward being more consolidated? And it's interesting that at the same time, there's a parallel development going on with, should we have a dedicated Department of International Health? Or should we just, all the departments in the school do international health? And so my interview with Margaret Bright shed some light on your question. So she came into the school as a sociologist and demographer, and she said she never gave up her sociologist identity. She continued to call herself a sociologist. Other people, even though they were trained in sociology, began to call themselves epidemiologists or other names. But she said, I really felt it was very important to keep that disciplinary identity of being a sociologist. So, as I think I said in the talk, by 1970 or so, I mean, there were people trained as sociologists in most of the departments of the school. But the advantages of having a dedicated department, as I'm sure David Holtgrave would say, are very important. And it provides a focus and a structure, and especially in obtaining funding for research, is very, very important, whether from philanthropy or government agencies. Having a dedicated department gives focus and direction and momentum to behavioral science research and perspectives that then help it actually disseminate that throughout the school. And that was also the case with international health, because when Carl Taylor first became chair, he said he got a lot of, people felt that he was competing with them. Other departments were already doing international health research, and we had a long history. And they were saying, why do we need a Department of International Health? And some people were probably saying, why do we need a Department of Behavioral Sciences? But for the reasons I've been saying, you can either kind of fly under the radar and just sort of come alongside people. And also time is a factor, because if you don't have dedicated full-time faculty doing behavioral sciences all the time, it's just not going to be as influential. So I hope that helps. Yes?
You kind of started around World War II. If we go back further, maybe talk about the social hygiene movement, temperance, and I guess probably also eugenics.
Yes.
What do you find in that era, I guess, particularly in regards to Hopkins and
Yes.
researchers sort of effectively do?
So the question is, if you go back before World War II and look at the earlier period of progressivism and the social hygiene movement, what do you find there and how is Hopkins involved? So my first answer to your question is Rockefeller. So the Social Hygiene Association is actually founded by John D. Rockefeller, Sr., who's very interested in promoting modern scientific methods of venereal disease control, and that was founded well before the school was founded. And it, I was going to say this, and I'll say it now. The whole terminology of what used to be a euphemism, a social disease. You don't want to catch a social disease. We're not going to actually explain to you what sex is or how you catch a social disease, but we're just going to say don't get a social disease. So bringing out the modern scientific approach to sexually transmitted diseases, and even the terminology of changing from a social disease to saying the word syphilis on the radio, which Surgeon General Thomas Perrin did in 1936 and got in a lot of trouble. So pulling these problems and diseases out of the shadows and into the public forum and really medicalizing them is a key part of what's going on in that period. And also, I have another hat as a development writer. I mean, the funding. It's the funding. The funding is coming from Rockefeller. The funding for the Population Council and the Population Association also coming from Rockefeller. So the international family planning movement and a lot of the trends in demography are being directly funded by the Rockefeller Foundation in the 1950s. And so people like Margaret Bright are using the techniques of sociology and demography to realize, oh my goodness, the world population is dramatically increasing. We had no idea how big it was and how fast it was increasing. And when they use those methods to start understanding, so the person that really stands out in the early period that you're talking about is Raymond Pearl. And so he's really one of the first population scientists, population biologists. And he and Lowell Reed, who succeeds him as chair of what's now called biostatistics, they create some of the first formulas for estimating the population curve, and I talked about this in a different talk. They actually estimate what they think the United States population is going to be in the end of the 20th century, and that's in 1919. So Raymond Pearl starts out as a eugenicist because the methods of understanding genetics and Mendelian genetics, they actually come out of agriculture. And Raymond Pearl started in agriculture, as did E.V. McCollum, chair of biochemistry. He started in agriculture. Many of the biostatisticians, like Chuck Rohde, was trained at a ag school, NC State. So what I will recommend, I can recommend all sorts of books on eugenics and public health and science if you want to. I'm a historian of race and medicine. I'm very aware of all that. But what I would say about Pearl is he thinks eugenics might be a good idea from a scientific perspective because if it works for plants, why not human beings? But then he recognizes that, one, eugenics is bad science, and that makes him angry because he's a really, really good scientist. And he also realizes that if eugenics really takes off, it could really discredit scientific research. And so he is one of the first scientists, very nationally known, prominent scientists, to actually speak out against eugenics. And a lot of the concerns about, quote, social diseases were that it would, and there's a very clear racial thread here that middle-class white people were not having enough children, and that syphilis might be causing infertility in some of those couples because of Victorian sexual mores. But there was also fear that the lower classes were having too many children. And so, syphilis treatment for one group of people and encouraging them to have children, and contraception for a different group of people. So that's kind of how eugenics linked some of those connections. Thank you very much.